packed agenda. So why don't we go ahead and get started, and people will catch up when they join. Thank you for joining us today on this Epilepsy Leadership Council webinar. We're really excited about what we're going to cover today and the team that we have covering it for us. These are who our speakers are today. You're very briefly going to see me, and then I'm going to pass it on to Joanna Gray, who's with Artemis, Laura Widener with Epilepsy Foundation, and Katie Collins, who's with Epilepsy's Action Network. And we're really going to take you through this journey. And hopefully this is very much building on our first webinar that we did last month, which we hope that you will watch as well, about advocacy. And this one is really digging a bit more into, what do the federal agencies actually do around epilepsy, and how we can work as a community to help improve those. Next slide. So for those of you who don't know me, my name is Gabi Conacher. I am the current chair of the Epilepsy Leadership Council, and I'm really pleased to be here with you and working with all of the amazing people who put this together. Some quick housekeeping, which is that we are going to be recording this session, which you all know because Zoom screamed at you when you came on. So we want this to be really an evergreen resource for the epilepsy community to come back to again and again, to really be able to get, the 101 and the 102s about advocacy in the epilepsy space. If you have questions throughout, please drop them into the Q&A, and feel free to use the chat as well as a way to share thoughts as we're going through this. We want this to be engaging. If somebody says something and it reminds you of something and you want to put it out there, just use the chat to kind of keep the conversation going. Okay, so why are we doing this training? Next slide, please. We have embarked, as you probably know, in the last few years in really kind of revisiting who the ELC is and what we're doing. But ELC has had a role in policy for a while. In 2018, we developed a policy agenda that served as a guideline for us about the kind of things that we would sign on to and circulate. And it was really focused on research in epilepsy, surveillance, data collection and prevention, and access to care. We are currently in the process of revisiting and revising our policy agenda, which is being led in a working group by Laura Widener and Joanna Gray, who are with us today. And we will be sharing that with members of the ELC. If you are not a member of the ELC, we welcome you. Reach out and be in touch to help us approve that policy agenda. Next slide, please. And the reason that we're doing this series of trainings is really that we heard loud and clear from the epilepsy community and the members of the ELC that they are very interested in doing more around advocacy and becoming more engaged, which is amazing because we need it. And the time is really right. There are amazing things happening throughout the epilepsy space. And we'd love to figure out to really give people the information and resources about how you can step up and do more, whether it's simply signing onto a letter or getting really much more engaged. There's a lot of layers and levels to that engagement. So what we want to do today is, in part one, explain how the legislative process works. So please check that out. Part two is explaining how the federal agencies work. We want timelines because that's really important when it comes to advocacy. There are very tight timelines, and everything has to move at kind of a quick clip because it happens, on this annual basis. So we want to clue in a little bit about that. We want to talk a little bit about target agencies where we can create or expand programs or services. You'll hear today about, there are a couple of agencies that are really focused on epilepsy. Give some insider insights onto how the system really works. You have amazing guides today who are deep in this space and have done this work for years. And then, of course, we're going to follow up this webinar with another webinar or more webinars. We're not sure yet. We'll see what you guys ask for on how to be an effective advocate for change. Next slide. So I am really excited to pass it on to Joanna Gray. Thank you so much for being with us today, Joanna.
Awesome. Thanks so much, Gabi. And thanks everybody who joined us today. It's wonderful to see you. I am the first speaker to talk a little bit about what federal agencies do generally to give context for the more epilepsy specific information that some of my colleagues are going to share. So if you joined our session last time, we talked a little bit about the three branches of government and thought this would be a useful place to start again today. So we're really going to be talking about the executive branch, which starts with the president, of course, and then goes to the vice president and cabinet. And then, I wanted to say a million federal agencies beneath them, maybe not a million, but hundreds, let's say, of agencies and programs beneath the cabinet. We're also going to be talking a little bit about the way the legislative branch, how Congress affects what the executive branch does. And that's kind of our general overview for today, as Gabi said. So what do federal agencies do? So all authority stems from the president, whom the Constitution has given explicit authority to, quote, take care that the laws be faithfully executed. As I said, it's, it's a pyramid. It starts with the president, goes down to cabinet secretaries. There are sub-agencies beneath him or her, and several layers. The federal bureaucracy, especially for those of us who live here in DC, is pretty massive. And it takes, hundreds and thousands of people to keep all of the federal trains running on time. In terms of faithfully executing laws, I thought it was worthwhile talking about a couple of examples of the different, all of these link back to laws, specific things that Congress has done. But of course, there's different flavors of laws, which means there are different flavors of federal agencies. So the first thing agencies do is implement laws. So you can think about the Affordable Care Act, obviously a hugely important, huge piece of legislation that passed back in 2010, sets a bunch of rules for what health insurers have to do, sets new rules for them. It does lots of other things, but we can use that as an example. So that required a federal agency, in this case, the Centers for Medicare and Medicaid Services, and an office within them, to write, okay, what are the rules? We know that laws, even when they're thousands of pages like the Affordable Care Act, only get so detailed into how a particular law or program should be implemented. It goes then to a federal agency to say, we've been given this law, okay, what actually needs to happen? What are guidances or regulations to implement a law? Federal programs, federal agencies obviously manage programs. So we can think about the Centers for Disease Control and Prevention. The CDC has dozens of programs that do more kind of direct outreach to individuals, often in partnership with state public health agencies or nonprofit partners. They have activities trying to educate consumers about something. I've flagged here public health awareness outreach. There are surveillance programs where they track epidemiology of diseases and conditions, et cetera. So programs like at the CDC and other federal agencies have dollars that stay within the federal government, where there are folks who run programs or other activities. Of course, the federal government also gives out billions of dollars in grants that are dollars that go from the National Institutes of Health, for example, to biomedical researchers. It's of course not just NIH. There are a number of other federal agencies that give grants to various partners. And then the final category that I thought was relevant for this crowd is the federal agencies also perform oversight or regulation of an industry. So we can think about the Food and Drug Administration is an agency within Health and Human Services that regulates drugs and devices to make sure that medications are safe and effective. There's lots of other things federal agencies do, of course, and we're going to give some examples in the epilepsy community, but here's the kind of big picture of what the federal government does. I think I'm now going to pass the mic to Laura to get a little more specific about epilepsy-specific activities and programs.
Yep. Thanks. Hi, everyone. Laura with the Epilepsy Foundation. Really happy to be here with you to talk about the exciting topic of federal agencies. So as Joanna said, I'll start by talking about where some of the epilepsy-specific programs sit within the federal government. So this slide is just for those of you who are a visual, it shows where some of the epilepsy-specific programs are. It's organized by federal department. So that's kind of the top row. You'll see there's Health and Human Services, there's the Department of Veterans Affairs, and then on the right, we have the Department of Defense. And under each of those departments are certain agencies and epilepsy-specific programs. But on the next slide, for those of you who like words, we'll go into a little more depth on some of these. So again, under Health and Human Services, Department of Defense, and Department of Veterans Affairs, there are some epilepsy-specific programs. This list isn't meant to be exhaustive, but just some of the primary epilepsy-specific programs across the federal government. You'll probably recognize a lot of them. You know, ELC and RUN circulate letters supporting funding for these programs most years. I won't go into detail on all of them, but I'll just touch on two specific examples. The first of which I'm sure you've heard about is the National Institutes of Health. So within the NIH, there are several institutes that fund and focus on epilepsy. The primary one is the National Institute of Neurological Disorders and Stroke. If you Google NIH by disease, I think is how I always Google it. NIH does have an interesting table that breaks down by disease each fiscal year, how much of their funding goes towards each condition. I always like to remind folks, like, they have to categorize things certain ways, right? But even if it doesn't fall specifically in the epilepsy bucket, there might be research done that's categorized under another condition. Obviously, there are a lot of comorbidities with epilepsy. So you want to look at that table pretty holistically. But just as an example, in 2015, the NIH funded about $138 million in epilepsy research. In 2022, the NIH funded about $226 million in epilepsy research. So the amount is going up, which is great, but obviously a lot in the community. We would love to see even more because there's always more understanding and need out there in the community, particularly considering that epilepsy is the fourth most common neurological disease. In addition to just kind of strictly funding epilepsy research, the NIH also has some epilepsy-specific programs and forums, such as the annual Eye Care meeting. There's also the Curing the Epilepsies conference, which is hosted every 5 to 7 years by NINDS in partnership with epilepsy-focused organizations. A lot of you, I'm sure, participate in Curing the Epilepsies to some extent, but in case you don't, it ensures review and revision of epilepsy research priorities called the Epilepsy Research Benchmarks, and also provides critical assets to the community, such as the Epilepsy Therapy Screening Program. The NIH also has something called the Centers Without Walls program, which was established in 2010 to address challenges and gaps in epilepsy research, and also encourage collaboration and sharing of data and resources between researchers. And lastly, I'll mention under NIH, again, not exhaustive by any means, but another thing that the NIH does in partnership with the CDC and some other agencies is a registry that has a few acronyms to it. It was initiated to track infant deaths and was expanded up in age to capture deaths of young people as well. But for the epilepsy community, the important thing to know there is that that registry, again, co-housed by a few federal agencies, does give the ability to track SUDEP-related deaths if states opt into that registry. The second one on this slide that I want to highlight is the Congressionally Directed Medical Research Programs, or the CDMRP. This one sits under the Department of Defense, which sometimes people are a little surprised by, but it was started in 1992 via a congressional appropriation to foster novel biomedical research in response to community needs. The CDMRPs were intended to be and are complementary to the research that's funded by the NIH and other agencies. The goal of the CDMRPs is really to be high risk, high reward research that maybe other agencies are not inclined to fund, get that really high risk, high reward research out of the gate. Another interesting aspect of the CDMRP is that they are peer reviewed. So, people living with conditions sit on panels and help review which research projects are funded. There are three primary CDMRPs that touch epilepsy. There's an epilepsy research program, there's a traumatic brain injury and psychological health program, and there's also a CDMRP specific to tuberous sclerosis complex, TSC. In 2023, epilepsy under CDMRP got $12 million. TBI and psychological health got $175 million, and TSC research program got $8 million. And now that we're working on the fiscal year 2024 levels, we're pushing for the same amounts for epilepsy and TBI, and a $2 million increase up to 10 for TSC. And those numbers and programs might ring a bell because they were included in an appropriation support letter, in addition to a lot of the other programs on the screen here that many of your organizations supported. So we thank you for that. All right, my next few slides, we're going to talk about next how you create new programs or improve existing programs. So when you're trying to get a new epilepsy or any government program started or improve an existing program, there are three steps that are often followed. And this slide shows those. There's authorization, appropriation, and the implementation regulatory phase. And then I'll turn it over to Katie. There are some, workarounds and other routes that you can go, but this is, I would say, the most common path, particularly to start a new government program. And again, here we're obviously talking about epilepsy programs. So I'm going to stay on this slide and dig into what we mean by authorization a little bit. So what we mean there is that, again, particularly when it's a new program, a bill will need to be introduced and passed by Congress to authorize the government program to exist and be started. So that's Congress saying, hey, this program can be established. We want that to happen. Oftentimes, Congress will also say which federal department or agency or agencies, sometimes it's multiple, will manage that new program. And again, often the authorizing legislation will set some broad, high-level parameters for what the program should look like. The timeline on authorization, getting a program authorized can be quick and can be slow. It just kind of depends on a lot of factors, such as political interest and momentum. Is support for the program bipartisan? That obviously helps. Another big one is, will the program cost money? And if it will, how much is that? And obviously, often the bigger the price tag, the more challenging it could be to get the new program authorized. If the program does cost money, usually the authorizing legislation within it will authorize a certain amount of funding for the program to get every year. And oftentimes, authorizing legislation authorizes a program for a certain amount of time. Usually that's like 5 years or 10 years. And the intention there is that, the government wants to make sure that the money is being spent well, right? So they want to have the ability to kind of periodically reevaluate, like, is the program effective? Should it be tweaked? So again, which is why they often put time limits on authorizations. Still on the slide, the second part here, appropriations. So this is, if you don't work in the crux of government process, you might not realize just because something is authorized does not mean that money automatically flows to it. Oftentimes you have to do this second step too. Congress has said, hey, this program can start, we authorize it to happen, but you also have to make sure that the program gets money to get started. So this step is done through the annual federal budget and appropriations process. And whatever department or agency the program sits under, that's where you want to get the money. You want to get the money for them so that they can implement the program that your community cares about. So for instance, if the program is under the Department of Health and Human Services, the community would lobby for a line item and or report language within that department's bill, which is called the Labor, Health and Human Services bill, or for short, the Labor HHS bill. So just a few tips here. To be successful in appropriations, some of the things that you want to do are hold meetings with members of Congress who, particularly those who are on the appropriations committee, and even the relevant subcommittees, that's even more influential. There are also things called programmatic requests that are pretty wonky behind the scenes stuff, but basically every member of Congress, if you're a constituent, you have the ability to submit an annual form to your member of Congress to say, hey, these are the funding things that I care about. And because you represent me in Congress, I want you to care about them too. Then the member of Congress, looks at all the programmatic requests that they get and determines what their priorities are and what they're going to push for in the process. Organizations can also submit those. Sometimes it can be a little more effective if it comes from a constituent, but organizations can certainly also submit them. And then lastly, there are things called Dear Colleague letters. That is a very effective strategy. Those are a more public facing thing that members of Congress can sign on to, expressing support for a certain funding level for a certain program. And then those letters that members of Congress sign on to are sent to the Appropriations Committee as they start looking at their bills. So in that instance, the more members of Congress you get on the letter, oftentimes the more powerful that letter can be. Just a few more tips on the appropriations part. I know this is a lot, but want to give you guys all the tools that you could possibly have to be effective. It's very important to stay involved in the appropriations process the whole way. As soon as it starts, you want to be in the offices on Capitol Hill, again, particularly the approps members. You want to be talking to them, putting your funding priorities on their radar. The approps process normally drags on for, several months, if not beyond a year. So again, you want to stay involved the whole way, because if you're not up there reminding them that, hey, I'm watching, I see those numbers that you're putting in there, we like them or we don't like them, they very well could forget about your program. So again, it's very important to stay involved the whole way. Another thing is you want to make sure you work both the House and the Senate. Ideally, you've got your numbers, the funding levels you want in both chambers. Sometimes you'll only get it in one, but then again, to the point of working the process the whole way through, you always just want to stay on top of that. And whatever the final bill ends up being, you want to try to make sure, obviously, that the funding level you need for your program is in that final bill. All right, implementation is a little easier, at least from a strategy standpoint, I would say. So again, once you've gotten the program authorized, it's allowed to be started, then you've also been successful in getting money for the program. Again, the authorizing legislation often has some broad parameters for what the program would look like, but the federal agency who manages it also has a lot of discretion, usually, on exactly how the program is going to go. So that's where we get to the implementation phase. It's in the federal agency's hands. They're figuring out how to manage it. Sometimes the federal agency will have what's called a public comment period. They'll put out a proposed rule and say, hey, this is what we're thinking about when it comes to this program. And then there literally will be, oftentimes it's a 30 or 60-day comment period. And literally members of the public, whether you're an organization or an individual, you can submit comments and say to the federal agency, hey, I like that. I think this could be improved. I don't like this. And then again, the federal agency is to consider all of those and implement a final rule as they figure out how to manage the program. Last thing I'll say here is that sometimes federal agencies will issue guidance, just kind of a bulletin or an informational piece on additional guidance for how the program is going to go, or if they're going to tweak it in any way. That was a lot, but to bring all of that to light, I'm going to go through two specific examples. So hopefully these will help make all the really wonky things I just said real. So the first one I'm going to walk through is the VA, the Veterans Affairs Epilepsy Centers of Excellence. So step one, when we looked, the community looked at authorization of starting epilepsy centers of excellence, which again are care centers for our nation's veterans who live with epilepsy and seizures. Legislation, Congress passed legislation in 2008 authorizing, actually directing the secretary to establish these epilepsy centers. The authorizing legislation, again, I won't go into all the details, but it said, again, secretary, you are to establish 4 to 6 of these epilepsy centers within 120 days of enactment of this legislation. And it gave some other high-level contours for what those centers should look like. Authorization here for the VA Epilepsy Centers of Excellence actually happened pretty quick. If you remember, I said authorizing legislation, like any legislation, can move really quick, or sometimes it's really slow. This one was pretty quick. It was first introduced in 2007. And it actually was passed the following year in 2008. I would say I actually wasn't working in the community at this time, but I've conferred with some people who were. And they said that a few of the factors that really helped this bill get through so quickly are that one, within the VA, there were already MS and Parkinson's centers of excellence. So they're already looking at neurology. They kind of had a framework, and epilepsy centers were just kind of an extension of that. Also, a huge factor here was one of the leaders in Congress who really pushed for these to be started, was Representative Perlmutter of Colorado. He's no longer in Congress, but he's a great champion for the community, and his adult daughter has epilepsy. So just as a sign of how much personal connections can be, he really pushed hard for these centers to be established, and that helped get them through so quickly. Once these centers were authorized, we get to step 2, and they had to actually get money, right, to get off the ground. So again, this one was all pretty fast. The epilepsy centers were funded right away. They were funded internally, kind of with existing fund money that the VA had, through the annual appropriations process. And then starting in 2020, the epilepsy centers started to get a specific line item in the appropriations bill, which is always kind of a nice perk, because you're just like confident the money will be there. And then you see on the slide here that the epilepsy centers have been very fortunate to receive some really healthy increases each of the last few years, and that has been a result of successful advocacy and lobbying from some particular members of the community. And then on the implementation part here, I would say that a lot of the implementation of these centers is really at the VA's discretion. They put out an annual report in terms of what they're going to be focusing on. And for instance, the centers recently have been focusing a lot on expanding tele-EEG, and also expanding the number of sites. Earlier this year, there were centers started in Birmingham and Chicago. All right, and then my last slide is another second example. I'll try to get through this quickly. The National Neurological Condition Surveillance System. So we'll again start with step 1, authorization. The VA one was quick. Now I'm going to give you an example of one that was rather slow. So a bill related to this, I think I dug in history, and I think the first bill was introduced in 2008. This bill actually originated only as a registry for multiple sclerosis, and hearing that Congress doesn't always love to pass disease-specific bills. So Congress urged the community to expand to other conditions. First, they just expanded to MS and Parkinson's, and then eventually expanded to all neurological conditions. And the goal with this system is to get better data, particularly incidence and prevalence data on neurological conditions, which is obviously really needed in the epilepsies community. So there were bills introduced over multiple sessions of Congress, again, starting in 2008. And then in like 2015, I think it was, Congress started looking at something called 21st Century Cures, which was an initiative led by Representatives Upton and DeGette. It was bipartisan. They wanted to think of policy solutions that, again, would get at curing some of our nation's most prevalent diseases. The community smartly saw that as a great opportunity to include the surveillance system. So the community started organizing around that, and ultimately was successful with 21st Century Cures being passed in 2016, and the system, the CDC being authorized to start the system as part of that legislation. Now we're at step 2, and it actually did take a year or two of advocacy where it was authorized, but no funding was appropriated. But starting in 2019, the system started getting $5 million per year, which was the amount authorized in the bill. And then finally, we're at the implementation stage. So the The goal here, of course, was to have a system that would do data on all neurological diseases, but the CDC is approaching it in a few gradual steps. So they started with what they've called a demonstration project, starting with multiple sclerosis and Parkinson's, to figure out, kind of what the data recipe is that would work best. And then their hope is to be able to tweak that over time and expand it to other neurological conditions. So in 2019, the CDC held a big meeting of neurological groups. Several epilepsy organizations were there, which was great. The goal there was to start thinking of criteria to figure out how to prioritize subsequent conditions. And then the pandemic hit, obviously. So things have been a little delayed, but the CDC is very committed to this system. It's kind of expected that, to expand to additional conditions, that the CDC would need more than 5 million a year. So the CDC, I think, is trying to figure that out. And there are efforts, even within the epilepsy community, to try to get the epilepsies to be one of the next conditions. So there are efforts underway urging the CDC to look at how much that would cost to expand to the epilepsies in hopes that our condition could be one of the next. And I think that's it. Sorry it took so long. Passing it on.
That's great. Thanks, Laura. And hi, everyone. I'm Katie Collins with G2G Consulting and also with the Epilepsies Action Network. Laura did a great job giving some examples of what this legislative process looks like related to the epilepsies and things that are in shape to hopefully include the epilepsies, and wanted to share some examples from other communities that really show how we can use this legislative process to drive change and affect where funding and programming and policy are directed. So you'll see here, there's some examples starting with funding. So obviously we're talking about appropriations and both increasing funding that exists, directing new funding. So I think these are a couple of examples that show how this can be very, very effective. So the first is rare cancer. The rare cancer community came together to really say, hey, we need some more attention to some of these less common cancers. We need to drive therapies in this space. How can we direct federal funding to do this? And so $72 million in research funding over 4 appropriation cycles across multiple agency bills, I think, is a great example of what can be done when a community really rallies together. This is also an example to show that funding exists across multiple appropriations bills. We talk a lot about the Labor, Health, and Human Services bill because that's where HHS and NIH sit. So there's a lot of funding there. But, DOD, as Laura mentioned with CDMRP, has funding. FDA is also, touches health and directs priorities. So we have funding there. Same with the Veterans Health Administration is another place to look at directing federal priorities. So wanted to touch on that, as well as ALS. And I'm actually going to talk a little bit more about ALS on the next slide. So I'll skip that for right now. But the appropriations process can yes, direct funding, but it can also help establish programming, as Laura talked about. So wanted to give some examples here for, we can use the appropriations process to start a new program that, of course, ideally, most of these communities would like to see expanded later into something beyond just this initial funding, as Laura said, through the authorization process. But it's a great way to often start the ball rolling in the right direction. So just gave a couple examples here. These are from ones that I've worked on, which is why I use them. Childhood lead poisoning, establishing a pilot project to prevent lead poisoning through healthy housing. That's a project that's en route to bigger and better things, hopefully through an authorization bill. Pharmacogenomics is another example about how we can use a pilot program to direct priorities within the agency. In this case, it's the VA, to help provide a service for veterans. So that's programming, and then policy more broadly we can influence. So just an example here from ovarian cancer, but we can use these bills and their accompanying reports to show congressional priorities and demonstrate those to the agency. So in this case, urging CMS to provide coverage for a specific type of test. So just wanted to show the broad example of what we can do through appropriations as a community, and really how successful we can be in affecting change in this way. We can go to the next slide. So I wanted to go just in a bit more detail about what other communities have done to affect legislative change. And I chose ALS and Alzheimer's here because ALS is a little bit newer in its journey. It shows a bit more short-term accomplishments, whereas Alzheimer's disease has been going for decades in this space. And so you can kind of see the difference. But ALS started a push. I'm sure most of you remember the Ice Bucket Challenge and bringing an awareness to a disease. That was ALS. So they, as a community, have worked to increase funding through appropriations. They've used legislation to bring, increased benefits to their patients. They started a caucus, which I think most of us hopefully know that the epilepsy community, and this was Laura Widener's baby. So congrats to her for bringing that across the finish line. But we have an epilepsy caucus now, which is fantastic. So building a congressional base of champions to really care about an issue and help promote legislation in that space. Back to ALS, another research program out of NIH, that's through appropriations, and then a big push to pass a bill out of Congress, which is their Act for ALS bill. So that includes research funding, federal coordinating capabilities, and that was done through legislation. So that's more of a short-term example. Alzheimer's disease, you can see we start here talking about a caucus in 1999. So they have been going a long time. They have a large federal coordinating group that worked on establishing a national plan. So outlining, across the disease community, including the federal government, what do we need to do to affect meaningful change for Alzheimer's patients? And that national plan later became legislation. And that work, continues today. So you can really see, we talked about how often this can be the long game, but over several decades, what can be accomplished. But don't want to, undermine what we can do in the short term as a community. So hence the ALS example. But let's go to the next slide. I know we want to have room for questions, so I'll be very quick. I talked a bit about federal coordination on the past slide. We really want to encourage the community to be talking to agency partners, the folks that work and touch epilepsy across the different agencies. Want to hear from the community. That's how they make sure they're meeting the needs of the community, and make sure that we as advocacy members and stakeholders know what they're doing, so we can harness it and use it effectively. Want to talk about federal coordination because Laura did a nice job back in one of the slides that showed, okay, we have all of these different government bodies that touch the epilepsies. We want to make sure they're talking to each other. We want to make sure they're coordinating, that efforts are not being duplicated, and that they're really leveraging progress made across the government. So hence you'll often see, like I mentioned back in the Alzheimer's space, and I have a few examples down here, that the communities come together to build an agency coordinating committee within that space. So there's a note here about Alzheimer's having one. Epilepsy has one. I know everyone knows about eye care. And I mentioned cancer one, because that's my background, but two, I think the Cancer Moonshot is an interesting example of the White House really driving progress in a particular priority area. So bringing together all agencies that touch a certain disease. And so these coordinating committees often have reporting requirements that are set into place to hold the community accountable, to do things like set a deadline, make sure responsibility is assigned, that programming is moving forward, that policy changes are happening as planned. To summarize, using our federal partners, communicating them with is really important, and the work that they do across the agency, ensuring that they're coordinating and really making sure that progress at a federal level is as streamlined as possible. Joanne, I think over to you to bring us home.
Awesome. Thanks, Katie. So we have given you, a quick but detailed overview of kind of everything about federal agencies and how you can shape their activities. And so you may be wondering, okay, what does this actually mean for you? You're here because you care about the epilepsy community. You want to get engaged. So what should you do? I think the first kind of bucket of activities is to connect with some of the organizations that have been represented on today's call and other epilepsy organizations. We're lucky to have so many organizations in the epilepsy community who are all working together to kind of advance the ball. So I encourage you to look at websites, sign up for advocacy updates. You can get emails when there's an action alert, when it's, as Laura and Katie mentioned, there are particular moments when it's really important that the community say, hey, Congress, we're paying attention to what you're doing, and we really want to make sure that you're prioritizing this or that program. There also, you can come to Washington, or I guess one benefit, question mark, from COVID is that there's more and more virtual advocacy that's happening. So you can participate in a Hill Day without having to come to DC. There's more and more meetings with congressional offices. You can do them from your computer rather than coming to town. And generally, I encourage you, I think all of the epilepsy organizations care a lot about what the community thinks. The way we know there's an issue to tackle is when people living with epilepsy or medical providers flag an issue for us. Here's something we're seeing in our clinic. Here's something we're seeing in my family. I bet it's not just me. There's a problem here. Is there a way that policy can help fix it? So really encourage you to share. Unfortunately, there's plenty of problems to solve in the community. And so encourage you to share your personal story, your experience about living with epilepsy, caring for someone who does, to help kind of be the policy pot. As we've discussed, there's a lot that you can take to Congress, kind of in partner with an organization, or on your own. Members of Congress work for you. Their job is to hear from their constituents and to respond to things that you flag for them. So if you haven't already, I encourage you to sign up for your senators and your representatives email list, follow them on social media, etc. So you can see what they're interested in and what are opportunities to get involved. And we've talked about kind of the appropriations process versus the authorization process. And then more directly with federal agencies, Laura mentioned that there are requests for information or comment opportunities. Often organizations draft policy letters, but that doesn't mean that you can't go to regulations.gov and respond to something as an individual or as an organization if you're with one. The way that the kind of law works is that if it's a regulation with a 30 or 60-day comment period, the federal agency has to respond to what you say. So they put out a proposed rule, they get all these comments, and then when they put out the final rule, they have to respond and say, we heard from stakeholders that X. And so we're either changing what we proposed, or we appreciate their support, or here's why we don't think they're right. But it's a direct, your advocacy can really make a difference there, because again, they kind of have to, you're not just sending things into a black hole, they have to pay attention. And honestly, the slide is cut. Oh, okay, meetings and listening sessions, yes. The last opportunity, again, you as an individual can reach out to a federal agency, or again, kind of keep your eyes open to opportunities that are flagged by organizations. There are times when, say, the FDA that I mentioned earlier wants to hear from people living with a particular condition or their caregivers, so they can better understand the patient experience as they're thinking about drugs and devices. So there are opportunities when agency officials really reach out and want to hear from community members. Those opportunities, again, are often flagged by organizations. All this to say, there's plenty for you to do to get engaged. And, something that we always say is that to really accomplish all the goals we collectively have for the community, we're going to need an army to do it. And we're so happy that you're here so that you can join our forces. I don't know how tortured I'm going to make that metaphor, so I'll just stop there. And I think, Gabi, I'm going to pass it back to you for Q&A, and then we have kind of one immediate engagement opportunity that we'll flag right before we wrap up.
Thanks, Joanna and Laura and Katie. I thought that was, I learned so much listening. I think I know some stuff, and then am proven again that I don't. So love to. So this is really amazing. We have one question. How does the epilepsy community compare to other big disease groups like MS and Parkinson's? And what do we need to do to be more effective in increasing support for epilepsy research and programs? Big question. But I think that gets at the heart of what we're trying to get at here, right? Is like we see that there's success in these other spaces. Why did that happen? And how can we mirror that in our community?
I'll take the end of the question, and then I'll throw the start with MS back to Laura because of her expertise there. But I think that one of the things that we can do is really come together as a community. And really, Joanna made a metaphor about building an army. And I think I liked that because that's exactly what we need when we go both to Capitol Hill and, to the agencies, is to show that, that as a community, we really together are advocating for change and, expressing what needs to be done to benefit the entire community. So I think it's really a coming together across the space and really harnessing everyone to make this happen. And Laura, I don't know if you have some insights into MS in particular, maybe that you'd share given your experience.
Yeah, I mean, I think it's a complicated question, right? Because if you just look at the NIH, for instance, how much does the NIH fund each disease each year? I was just Googling to refresh my memory. I mean, again, in 2022, they funded MS at about 121 million. Parkinson's was about 259 million. Epilepsy was, I think, about 226 million. But again, it's all complicated, right? Because how big is the population size? And at the end of the day, the NIH funds research based on the merit of the applications, right? So it's not like they go in, necessarily having a certain amount of money for each disease. And then you got to look across agencies to total everything up. I mean, there's certainly in other communities, as we highlighted, certain communities have managed to get set-asides or specific amounts of funding for their disease. I just want to emphasize there, it's all complicated. I think what Katie stressed is the most important takeaway, that I think what I agree with the epilepsy community, the best thing that we can do is come together and all be pushing for the same things. Different organizations will have their own priorities as well. But like where we can come together, that's really important, because the louder our voice is to the Hill and to federal agencies, the more effective we will be.
And if I can just share just one 10-second thought, there's always more that the government can do to support the epilepsy community. That's why we all have jobs and what we're all, trying to accomplish. But I also think it's worth taking a second to really be, to appreciate. We had a whole slide of all the epilepsy specific programs across the federal government. There's a lot happening. And I think that we, as Katie discussed, there's ways to try and shape what agencies are doing. That's a whole kind of type of advocacy, but there's always more. But I know there are plenty of patient communities who would be thrilled to have what we have, just like there are some patient communities we might envy as well.
Yeah. And I think the thing that I always come back to is I think about the statistics that, 1 in 26 people will develop epilepsy in their lifetime. If we had every single one of those people on the Hill together, we would be such an incredibly loud and passionate voice for change. And so I think that mobilizing the community in that way is just an incredibly powerful prospect. There's a question, Laura, maybe you can answer this in the chat itself, because we're running out of time, about the form for annual appropriations. But I want to get to this other question. So what is the typical timeline or schedule for the appropriation process? And what are the most effective times to get involved?
Yep, I can tackle both of those together. So typically Congress starts looking at the upcoming appropriation cycle, whether or not they've concluded the last one. But typically in February, March of each calendar year, they'll start thinking about the subsequent fiscal year. So February, March is when you should start paying attention and start talking to your members of Congress. The forms are typically in that time frame too. Like some deadlines can start as early as like late February. And again, March is a heavy time when those form deadlines are. Each congressional office will have their own deadline. So, whoever your members of Congress are, you can ask when those are to make sure you get them in on time. You can certainly rely on, organizations or friends at organizations who could help you complete them if you need that. But yeah, I think that tackles the big things there.
And what's the name of that form, Laura, and where do people find it?
They're called programmatic request forms. So yeah, you just want to reach out to your members of Congress, and again, probably February, and ask when their deadlines are, and they'll provide the form. Oftentimes they'll post them on their public official website, or the staffer can email them to you.
Beautiful. Okay. So we are right at 5. So right at the hour mark here. I want to thank everybody for joining us. This is a fantastic conversation, and we really look forward to this being a resource that lives on. And that doesn't mean we won't still be here. So reach out if you have questions. There will be another webinar coming soon. So be on the lookout for that date. And we wanted to give you an opportunity to weigh in now, for an opportunity to share your voice about what is most important that we look at. There's a group called the Epilepsy Action Network, which a group of us who are present today are a part of as well, wearing our many different hats. But this group is working on the Hill to try to raise awareness and funding for epilepsy. And we want to know what is most important to you. What do you want to see addressed about epilepsy? So there is a form here where you can fill it out to share what's most important to you. And if you're not really sure what it would even look like to develop an ask, we're going to be having, there's a workshop on July 27th that people can come to talk through with Katie and some other folks who are working with us on this about what is a good ask and how do you formulate one of those. So thank you so much, everybody, for joining. It's always a pleasure to be on here with you, to be in community with you, to be building something with all of you. If you have questions, please feel free to reach out to us, and we look forward to seeing you next time. Thank you so much to our speakers and everyone.